Arthritis is a condition that affects millions of people across the globe, and as people age, it can prove to be a hurdle in the long run. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about arthritis in our today's episode. Joining our program today is Dr. Jithin Mathew, consultant rheumatologist from Yashoda Hospital's High-Tech City. Welcome to the program, Doctor.
Hi, everyone.
So, Doctor, the prevalence of arthritis is higher than many well-known diseases across the globe. So, to begin with, what is arthritis and what are the different types of arthritis that we know?
So, to just answer about what exactly is arthritis, arthritis is a problem which primarily affects the joints, right? What is osteoarthritis? But which is basically a degenerative condition wherein the space between the joints reduces and you have pain. And this mostly affects the knees and in elderly people. However, the other types of arthritis that we are primarily concerned with is inflammatory arthritis. So, inflammatory arthritis is what usually the small joints of the hands, sometimes the legs, the knees, and these type of arthritis is with swelling. So you will have swelling in the joints and swelling in the knees. And this swelling basically suggests that there is inflammation, active inflammation going on in the knees. So this is what is the typical pattern of what we call rheumatoid arthritis. However, we should understand is that arthritis is not a single disease. It is a symptom of an underlying disease, the most common of which is rheumatoid arthritis for the rheumatologist. Other diseases which can present with arthritis are very broad, like it can be due to psoriasis, it can be due to spondyloarthritis, it can be due to gout. So what type of arthritis it is, what is the underlying condition causing arthritis is the first thing that we need to assess, and that is what we do, what the rheumatologist or the doctor treating you does. And subsequently, we then decide to assess and then treat the condition. So I want to re-emphasize that arthritis is just a symptom of an underlying condition, which we need to evaluate further.
So you've mentioned that arthritis is very prevalent among different age groups. So what are some risk factors which are associated with this condition, Doctor?
The risk factors will depend on the underlying type of arthritis. So I'll just stick to maybe say two most common types, which is say rheumatoid arthritis and spondyloarthritis. Now the risk factors are, it's usually a multifactorial condition. It's not like one particular thing causes it. So it can be due to familial, some people who have a strong family history of arthritis, say mother, father, brother, sister, multiple members of family being affected, yes, they are at a higher risk than the normal general population to develop arthritis. However, that does not mean that if you have a affected first-degree relative or a sibling or someone with arthritis, you will definitely get it. The chances are a bit higher, but it is not definite. So apart from these other risk factors, for example, if you have psoriasis or you have a family history of psoriasis, you may have a higher risk of developing psoriatic arthritis. If you have back pain and if you have a family history of someone with, say, back problems, spondyloarthritis, you may have a higher risk of developing spondyloarthritis. So it is mostly related to do with family. The other important risk factor which I would like to emphasize is the environmental, the modifiable risk factors, top among which is smoking. So smoking is very important risk factor for rheumatoid arthritis as well as spondyloarthritis. Not just causes the disease, worsens the disease, makes the disease less responsive to standard therapy, and at the same time it also increases the rate of progression of the disease. These are the most common risk factors that I would like to emphasize on. There are other environmental risk factors like pollution and previous infections, etc. But these are the ones what we primarily try to look at, which is mainly smoking and familial hereditary risk factors that we speak about.
So you've mentioned that arthritis is a symptom of an underlying disease or a condition, Doctor. So when do you think one should consult a rheumatologist for this right away?
It's a very pertinent question. So what I want to say is that a lot of people who come to us who are coming with pain. So what we should recognize is if pain is due to arthritis or if it is not due to arthritis. Now, pain is a very common symptom. It can be due to varied amount of causes. It can be due to some thyroid disbalance, vitamin D deficiencies and vitamin B12 deficiencies, etc. So these are not all pains are due to arthritis. The problem comes when we need to recognize if this pain is due to arthritis or not. Now, what we look at is if you have pain in the small joints of the hands, say your finger joints or your wrist joints, and the pain is more during night time and you wake up in the night because of these pains. When you get up in the morning, you feel that your hands are stiff. It takes maybe an hour, 30 minutes, 45 minutes for you to get going and for you to be able to feel normal. Yes, that is suggestive that this may be arthritis and you may need to be evaluated for the same. If you have swelling in one of your joints, say your finger joints or your wrists are swollen or your elbows are swollen, you're not able to fully move your elbows, your wrists or any other joints, then yes, it may be a symptom of an underlying arthritis. So therein, yes, you will need to come and visit the rheumatologist. If you have a family member who has affected arthritis and you've started developing joint pains of late, yes, again you need to visit. It may or it may not be arthritis, but that needs to be confirmed by examination and by testing if required. So in brief, if you have pain in the small joints, if you have swelling of the small joints, if you have significant stiffness in your joints, especially in the morning hours or in the late night hours, yes, you should definitely consult a rheumatologist. Apart from this, if you even have, say, something like back pain is also very common. But especially if you have back pain which is worse during the night, or again early morning when you get up, the back pain is not significant enough to prevent you from walking about normally, yes, it is significant and you do need to consult a rheumatologist for a probable inflammatory cause of these problems.
So once a person is diagnosed with arthritis, doctor, what are the different treatment modalities which are available?
So once we diagnose that, okay, someone has arthritis, so it depends again on the underlying cause of arthritis, as I said. So I'll stick to, say, for example, rheumatoid arthritis, the most common type of inflammatory arthritis that we treat. Now, the treatment has two approaches to it. One is non-pharmacological and also we have pharmacological, which means what is to do without medicines and with medicines. Now, without medicines means basically the lifestyle modifications. For example, as I said, smoking is an important risk factor. We strongly instruct all these patients to decrease or better still, to totally quit smoking altogether. Apart from these, the other non-pharmacological measures include having a good, healthy, balanced diet, avoiding, say, processed foods, etc. Once we come to the pharmacological therapies, yes, there are medicines available, which what we call the disease-modifying agents, which will decrease the inflammation and control the inflammation in your joints. It may at some times also be given some low doses of steroids. Now, what I want to emphasize again is that steroids, it's a common misconception, it's actually true, but the conception is that steroids cause a lot of side effects. Steroids, yes, they do cause side effects, but that is if it is taken at a higher doses for a longer duration of time. When taken in the appropriate dose for a short duration, that is the best therapy to initially reduce the symptoms while the main drugs start to act. So basically, it will be low doses of steroids, which will then be stopped, and then other medicines like what we call disease-modifying agents, which will be added. Apart from this, depending on the other risk factors, we will also we will have a look at vitamin D levels, control the vitamin D supplementation with vitamin D levels, and also advise physiotherapy to the joints as per the requirement. So that is the general modality of how therapies go.
So undoubtedly, non-pharmacological therapy plays an important role in improving the symptoms of arthritis. So what are some lifestyle modifications that you would recommend for this condition, doctor?
So the general lifestyle modifications kind of remain the same what we advise in general. As I said, quit smoking, avoid alcohol use to the extent possible, because alcohol use also worsens, for example, say it causes your bones to become weak. Certain types of arthritis like, say, gouty arthritis is triggered by alcohol use. So these alcohol and smoking in general are advisable to avoid or cut down on their use. Regarding other risk factors, balanced, healthy diet is always important. There is no such thing that you should not take, say, non-vegetarian diet or proteins or anything like that. These are common misconceptions that is prevalent in society. Otherwise, it will be a good, balanced, healthy diet. Avoid a lot of carbohydrate-rich diet. Avoid a lot of processed foods. Include a lot of fresh fruits and vegetables in the diet. So that should take care of the overall antioxidant balance and helps to promote overall joint health. One more thing is, especially with respect to rheumatoid arthritis, yes, a good oral hygiene is very important. So if you have a few teeth which are decayed or bad, or they are on the verge of they are causing you problems, please get it evaluated and checked. Have brushing twice a day, maintaining a good oral hygiene is also a very key part, because the onset of inflammation is supposed to start in the oral cavity, in the gingiva, in the gums. So therein, having a good oral hygiene is also very important. With respect to spondyloarthritis, yes, regular exercises are very important. For any type of arthritis, we always advise at least a good 30 to 45 minutes of physical activity daily. It overall helps to reduce your weight and helps to regulate the overall immune disbalance. Thereby, it will help you as a whole. So that is what in general I would advise.
So discussing about diet and food, are there any specific food that you would recommend or avoid when one is suffering with arthritis?
there are no specific food that I would recommend to avoid, in the sense that a normal, healthy, balanced diet is good. You can avoid taking excess sugar, sugary stuffs, sugar-sweetened beverages, fructose-sweetened beverages like cold drinks or etc. Other things, as I already said, if you have gouty arthritis, yes, you may need to cut down on alcohol, especially beer, because it has a lot of purine content, cashew nuts, seafood, etc. Otherwise, in general, in rheumatoid arthritis patients, apart from a normal balance in the healthy diet, also avoid, say, taking stuff like a lot of processed items like sausages and frozen processed foods, because these have chemicals which can trigger the immune process and prevent the disease from going under control. So again, that is also very important. Diet. Also include a lot of fruits and vegetables in your diet. They have a lot of antioxidant contents, and they again help to reset your immune dysregulation that has happened, and it will help your joint health and your overall health in general. So apart from this, I also cut down on using a lot of fried foods and fatty foods, because again these will affect your gut disbalance, and that again is indirectly affects your joints. So this is in general what I would advise about dietary practices in patients with arthritis.
So before we wrap this episode, doctor, what message you would like to share with our audience out there as far as arthritis is concerned?
So the message that I would like to put across to the audience is arthritis is very common. It's, as was rightly pointed out, probably 1 or 2 out of every 100 people will have some form of arthritis, more higher if we even count osteoarthritis, and it is treatable. It is very well manageable, and you can have a very healthy lifestyle despite having this condition. It should not be seen as something that deters you. You should just, if you are having a doubt that you may be having this condition, please visit a rheumatologist. They can manage, they can give you medicines to control the inflammation in conjunction with other non-pharmacological therapies. You should be able to have a very good, healthy, productive life. As already mentioned, if you have symptoms suggestive, small joint pains, swelling, significant stiffness in the morning, please visit the doctor or the rheumatologist to get evaluated for the same. It is treatable, it is manageable. You can have a very healthy lifestyle despite having arthritis. Just treat it like any other chronic conditions like asthma, diabetes, hypertension, which can be very well managed with medicines and lifestyle modification. That's my message to the audience today.
So thank you, doctor. It was wonderful having you here on the episode today.
Thank you.
So this brings us to the end of this episode. Remember, with the right knowledge and support, arthritis can be managed. And don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.